name is Pascal Vranckx from Hasselt, Belgium. I welcome you today on ESC TV, and I'm going to introduce an interview for you Dr. Hector Bueno, Professor on Clinical Cardiology in Madrid and Acting President of the Acute Cardiac Care Association for the ESC. We're going to talk today about the Clinical Decision Toolkit. Hector, what's the story about the Clinical Decision Toolkit? Why is it that successful? More than 12,000 copies distributed, more than 15,000 downloads, more than 50,000 page views. Where does it started?
Well, it started aligned with the mission of ACCA, which is improving the quality of care and the outcomes of patients with acute cardiovascular diseases. We realized that although there are guidelines, there are still many gaps in the knowledge, and also for non-cardiologists, the process of caring acute cardiac care is long and becomes, and the patient calls the emergency system and goes to the hospital. So there was a need of a tool that helped people to get all the knowledge and indications for the care of these patients.
Who do you want to reach? Just cardiologists?
No, definitely not. That wouldn't improve really the care of these patients. We need to start from the ambulances in the emergency rooms. We need to count on intensivists, on the internists, of all the people involved, nurses, all the people involved in the care of these patients. So cardiologists, we're just part of the chain of care of these patients.
It's clear that this toolkit is more than a guideline. Where's the difference?
Well, absolutely. It's a companion of the knowledge, but there's many gaps in the knowledge of patients with acute cardiac care. So it of course, gets all the indications of the guidelines, but also it has all the recommendations of real experts in every field on acute cardiac care, clinical experts. So there's clinical recommendations beyond the guidelines, because sometimes there's no evidence.
After the printed version, the online version, you're now also going live. The app is now available in the Apple Store and on Google. Why going live? What's the aim?
Well, the toolkits, the booklets is very interesting, but young people are more used to use it in their phones, in their tablets, and particularly when you're with the patient, this is really a tool to use it in the bedside. So you can really use it to make your clinical decisions at the bedside. So sometimes you don't have the possibility to have it, so you can use it immediately in your phone. So we thought it was useful to have it.
2 chapters available now. Mm-hmm. What can we expect in the upcoming weeks, months?
So acute coronary syndromes and acute heart failure are already available, and all the others will be coming. So the main symptoms, chest pain, dyspnea, syncope will be coming soon, and all the others, cardiogenic, cardiac arrest, aortic diseases, pulmonary embolisms will be coming in the next months.
Fantastic. A dynamic tool, updated on a regular basis, and soon available for us, the clinical community, taking care of cardiac patients. I thank you for being with us at ESC TV. It was a pleasure to have Hector with us. Hector, thank you very much.
Thank you, Pascal.